Our next case here, we have two slides. So you can see at low power, we have almost a cystic type area here, and then some relatively normal lung parenchyma. If you actually look down in here within the blood, you can actually see these structures here. So these structures are actually organisms, and so these are actually protoscolices from an echinococcus. And the one nice feature here is you can see really nice hooklets here. That one's a little bit out of focus in the slide, so I think we'll move around and see a few more. Another one here cut in a bit of an odd section. You can also see these calcified structures, which are known as calcaneus corpuscles, that are also features of this organism and thought to play a role in excreting waste and also as a storage system for calcium and other material. So you can see quite a few of these organisms here. Here's another one. So these are protoscolices, which are the juvenile form of this worm. And so the life cycle of this worm is actually in the definitive host, which are typically wolves or dogs. They will form the full adult worm in their intestinal tract, which will then lay the eggs, which can then be ingested by a secondary host, including humans, which will then hatch within the our GI system, and then they will penetrate through the intestinal wall, where they can then enter the bloodstream and then get to various organs. So these will form these cystic structures in both the lung, liver, as well as they can occur in the brain, and then they'll form these protoscolices. And the way that the infection cycle continues, if then this tissue were to be ingested by a wolf or a dog, they could then reform the full adult worm and continue the life cycle. This is another section from the case which shows the wall of the cyst, which has this characteristic appearance. It has this characteristic laminated appearance here. If you look at high power, it almost looks like you're looking at the rings of Saturn, where you have this concentric layers of material. This is positive on GMS, as well as they have this granular cell layer here, which I'll just move up to here, which I think shows it a little bit nicer. You have this granular cell layer here, and then on top of it, you can see some protoscolices as well as this calcaneus corpuscles. So this granular cell layer is actually what forms these protoscolices. And so I kind of think of it as this is like a factory that is then producing these juvenile forms of the worm. So it has this kind of interesting mechanism of propagation. And if this granular cell layer, any of this is actually left in the patient, this is actually what can continue to cause disease as well. So this is a classic case of a hydatid cyst or a echinococcus.